Welcome PA students and PA graduate students. In this session, you'll be hearing from graduate students
Did you want us to get started? I see there's some attendees.
Yeah, I can go ahead and
I'll
start.
message Sakura to see if she's coming.
Okay.
She'll get on. I thought at 1, but she didn't do the central time. I'll let her know.
Sorry about that. Time differences can get a little funky
It's okay.
sometimes. We appreciate you all attending though. All right, okay, we got some more attendees here too. So we're up to 5, that's great. All right, so welcome to our pharmacy graduate student panel. So this panel will kind of allow Iowa State students the opportunity to ask questions to pharmacy students. Our basic agenda is that we will kind of start off with some brief introductions from each student. They'll kind of go through their name, the current pharmacy school they attend, the undergraduate they went to, and their current year in pharmacy school. And then we'll go into some questions collected from Iowa State students over the past week, and then we'll go into some chat questions. So for our order for graduate students, maybe kind of try to go in the order that you came in, just so we don't have too much awkwardness with Zoom. But if you just kind of start whenever you'd like, that'd be awesome.
I think that starts with me then. So hi, everyone. My name is Mariah Moravchek. I am a third-year student pharmacist at Northeast Ohio Medical University. I didn't want to write the whole thing in the chat there, so Neomed we go by. And I'm excited to be here. We're about an hour outside of Cleveland, if you're unfamiliar with Ohio, and I went to undergrad at a small school called Youngstown State University, so I'm from the Youngstown area.
Hi, I'm Lauren. I am in the University of Iowa College of Pharmacy. I'm in my first year, and I did my undergrad at the University of Iowa too.
Hi, I'm Mackenzie, and I'm a current third-year pharmacy student at Drake University. I did the Drake pre-pharmacy program, so I actually don't have my undergrad. So I did 2 years of pre-pharmacy at Drake and then got into the pharmacy program for the next 4 then. I'm also doing a dual degree at Drake, the PharmD MBA dual degree.
I can go. So my name's Tyler. I also went to the University of Iowa for pharmacy school. I am currently a second-year student. I also went to undergrad here and did only 3 years of undergrad and then just went on to pharmacy school.
I'm Lauren. I go to the University of Colorado Skaggs School of Pharmacy. I'm also a second-year pharmacy student, and I did my undergrad at Bethany College, which is a pretty small school in Kansas. I also did not do an undergrad degree. I did my 3 years of prerequisites and then applied and got into CU.
Awesome. All right, so we're just going to start off with kind of a general question of what made you choose your current school and how did you decide where to apply? I hear that a lot of you kind of started doing prereqs at a school and then kind of went on there. But yeah, like what made you choose your school that you attend right now?
I can go. So when I did my undergrad, I played collegiate softball. So that's really why I went to Kansas. Otherwise, I probably would have stayed in like Colorado because I'm from Colorado as well. So I probably would have stayed here, but I wanted to play my sport. So I went to a different school, but that's really why I came back, was to come back home. And University of Colorado is a really good program. And we have 3 hospitals on campus, as well as all the other, we have the med school, PT, dentistry, nursing, all of it's on our campus. So it's kind of nice just being able to work with all of them and seeing them all around. So that's why I chose CU.
So I chose the University of Iowa because way back when I first toured the campus, I instantly fell in love with how beautiful the campus is at the University of Iowa. And then throughout my undergrad, I quickly came to just love the community and how easy it is to get involved and kind of give back to the community. And we have a really good College of Pharmacy program, and just kind of knew I wanted to stay in the area and keep doing what I'm doing.
I can follow up. So I chose Neomed because I'm pretty shy of a person. I don't like big crowds of people. So we have about 90 kids in my pharmacy class, and I think that's kind of a big class for our school. And I can tell you that I know every single one of their names. We all know each other. It's just that family feel. And that's really why I was drawn to a smaller school like Neomed. But on top of that, the fact that we can work so closely with our faculty and they know us and they recommend us for things, like a lot of my really awesome experiences have been because my faculty members know me and I've been able to work with them. So if you're interested in more of a small town feel where you know everyone and everyone knows you, that's why I chose Neomed.
I can kind of follow that up with a lot of the same feelings as Mariah. So I initially chose Drake because I was looking at 6-year PharmD programs. So that might not apply now, but I'd say about 80% of the Drake pharmacy class is students who did do the pre-pharmacy at Drake, just to put that out there. And our class is my current class is about 90 kids too. And so I really think you have a good opportunity to get to know everyone and also know your faculty very, very well. One of the main reasons I chose Drake over other 6-year programs was that I could do and pursue a dual degree and be able to graduate at the exact same time as I'm going to graduate with my PharmD. And that was just a big plus for me, because some schools it requires an extra semester or extra time, but I'll be able to graduate next May with both. And so I think that's something you might want to consider if you're interested in any dual degrees like that.
A big part for me of what drew me to Iowa was the people. Just going there on my interview day, they call it our Pharmily, and that really is what it feels like. It's like a super close community and all the faculty and everyone's really just rooting for each other and supporting each other and everything.
That's awesome to hear. I'm glad you guys have all kind of found places that are a good fit for yourself. We do have one question in the chat from Sammy Nelson that asks, what is the benefit of a dual degree? I'm assuming that's kind of aiming at what the goal is or what the benefit is.
Yeah, I can kind of talk about that. So for me, I'm doing the MBA. So there's also different dual degree programs that Drake offers, and I know other schools offer too, such as your MPA, MPH. A few of my friends are doing those too. Pretty much it expands your skill set to be able to move into leadership positions and possibly different areas of pharmacy, such as industry, or like management, a little bit accelerated. You don't need a dual degree to do any of these things by any means, but if you know that's kind of the path you want to go on, it can help you to get those skills in a lot of fellowships and residencies, and also some like leadership positions later on in pharmacy. Like if you wanted to be a director of pharmacy someday at a hospital, they might require you to go back and get your MBA. So leadership is something that I'm just interested in as a person. And I also wanted to like broaden my horizon, I guess, in the pharmacy world. So that's kind of why I did it. Initially, when I decided to do the MBA program, I had no idea what I wanted to use it for, and I'm still kind of exploring that. But with it at Drake, being able to do it at the same time, I just decided it was worth it for me to do that during pharmacy school.
Awesome. All right, and we have another question from the Q&A asking, how are the financials? Are you able to work during school?
I can start with that one. So I think one of the most important things that you should look for when you're looking for a pharmacy school is the cost that you're going to spend on top of the return of investment. So obviously you want to go through a school, you want to finish that school, but make sure it's a school that's going to get you the degree that you want, help you pass all of your boards and your finals and things of that nature so that you don't have to spend any additional money. In terms of working, so I know at Neomed, most, if not all of us, do have an internship working at some sort of pharmacy before we graduate. They tell us not to keep jobs that are not really pharmacy related, because if you're then, your grades start slipping and you have to repeat a course or repeat a year, you're spending more money that you would have been saving by not working anyway. So my recommendation is really just to find what's comfortable for you. I know my job, I only work 1 week in a month, and that's perfect for pharmacy school world. Some people will work, 1 day a week. Whatever you're comfortable with, try to work that out with your boss, but also look for a job if you're interested in one that's going to be really flexible with your schedule.
I think going off of that, what I've noticed is a lot of the places hiring pharmacy students are super aware of how busy we are and how jam-packed our schedules are. So everyone really is willing to work with you and find hours that work best for your schedule.
I would agree with everything they said. I think at Drake in my pharmacy class, I would say everyone works during the school year. I currently have 2 jobs that I kind of go back and forth, but I work really closely with my bosses to figure out my schedule, and they're pretty flexible with that. I also think I am also a TA at Drake, which is a really nice option because our TAs are paid. And so it's very, very flexible, especially when you're hired through the school, because they understand even more than kind of outside companies. So I would say if you're trying to work and make a little bit of money during school, maybe start with your university and then expand from there.
All right. Oh, we have another question in the chat. What are your favorite study tips in pharmacy school, and maybe study tips that you really liked in undergrad that you ended up changing?
So it's kind of an interesting thing. So when you start pharmacy school, it's very common to like change your study habits completely. Just it's so much more material in a short amount of time that you have to figure out a new way to study. Studying in groups is always a great idea. Teaching them, they'll teach you back. It's kind of a nice way to do it. It's different now with like being online and stuff like that, but I mean, still doing Zooms, like group studies. Our school does offer a lot of, they have free tutoring, so you can have an individual tutor as well as we do groups tutoring with an upperclassman. So those are really good to go to. They get you prepared for all quizzes, all exams, stuff like that. But yeah, just not being afraid to change your study habits, because you're gonna have to find something that works really well with a lot of information at a time.
I agree with all that. And I was going to piggyback by saying find little tips and tricks that work personally for you. I don't know if any of you are fans of The Office, but one of my favorite quotes is, "I'm not superstitious, I'm a little stitious." So if you kind of have your set plans going into all of your quizzes and exams, that helps you. That's what I do. So when I was a P1, they had told us about the rule of three. I'm not sure if anyone's heard this, but you really don't understand the material until you've seen it 3 times. So for us personally, all of our lectures are recorded. So I go to the live lecture, I watch the recording, and then I study the notes. And just by doing that, you've already seen it 3 times. And anytime more that you want to study after that, that's totally on you. But at least you're kind of comfortable with the material. And also just for fun, like when I write out my notes, I have to use pink ink because I think pink is just fun. I refuse to use any other color. So that's just one of my little study tips that I think helps me. It's fun to look at, helps you study a little bit more. So definitely what Lauren said, but also just make it personal to you. That'll help you a lot.
Yeah, I was also going to go off of that. I really like the rule of three because now I'm thinking about that and I kind of do that. But the big thing for me is also repetition, just like keep looking at the information. So similar to Maria, I'm a big Quizlet person, so I'll go to live lecture, rewrite the lectures, and then when I'm rewriting the lectures, I'll put it into a Quizlet, kind of as that additional like going over it. I would also say if you're a picture person, like just drawing out kind of ways to like think about things and also like working with other students and teaching each other is like really beneficial.
One thing I also do is I just talk everything out, even if the people around me have no clue what I'm talking about. It kind of helps you too, because then you might have to explain it a little more just to see if they understand it. So that's kind of fun too. They don't always enjoy it, but I do.
I think what helps me, because like Lauren said, it is so much information in a short amount of time. So I feel like what really helps me is I use an iPad and I will download the slides and just write right on there on my iPad. And I feel like I just really pay attention to what the professor is actually talking about, because a lot of times there's so much information on the slides that they don't even really mention. So you definitely have to try to narrow down what's really going to be important and focus more on that.
Just a small note off of what Lauren said. So I'm a P3, my last semester of didactic coursework, and I just got an iPad for Christmas and I'm finally using it for school. I wish I would have had it 5 years ago. So if that's something you're wanting to invest in before pharmacy school, I would definitely recommend it. You don't need it by any means, considering I'm almost done with classes, but it's really been helpful for me since I've had it.
All right, so looking at our next question in the chat, someone asked, what part of the application process did you find the most difficult?
I would say probably the most difficult for some people is finding like references. So that's definitely something that I think I would recommend thinking about now than later, just like periodically like, who can I ask that would be good to like write a reference for pharmacy school? And that can be a variety of people. I know I did a old manager at one of my jobs that I worked at for 5 years, and then a professor at at my college that I really liked. But I would say sometimes that can be difficult.
I wanted to throw in really quickly. So the past 3 years, I've had the honor of serving on our admissions committee at school. So it is kind of cool that I can now see the process of what it takes to become an applicant and become, to matriculate to the actual schools. So one, I recommend if you have the opportunity to join your admissions committee to try to reach out and do that. But I would say interviews for me were probably the most difficult part of the entire process. There's just so much pressure to make yourself sound like someone that they want to take in. So practicing with someone is always a great way to kind of get those nerves going. You can Google like the most common pharmacy interview questions and just ask someone to ask you them and get their feedback. But always reaching out to older people, if you know anyone in the program, or if you know any pharmacists, or just really any adult that's gone through the process, I think is a great way to kind of help you out. But I just wanted to plug, if you have any application or interview admission questions, that I'd be happy to take them.
I think what was probably the most difficult for me wasn't really even a specific part. It was just right when you first start, there's so much that you have to do, and it's kind of overwhelming to like look at all of that and be like, I have classes and work and everything else going on, and I have to do all of this. But I definitely recommend just starting early and doing it just little chunks at a time, because it definitely looks really overwhelming when you first start.
All right, so we have another question. Do you do research in pharmacy school? And if not, what kinds of extracurriculars do you participate in?
I can kind of start with this. So Drake is also interesting because up until my P2 year, I was still kind of looked at as an undergrad. So I was still involved in like my sorority and things like that in undergrad, but more pharmacy related. I'm involved in a pharmacy fraternity, multiple pharmacy organizations, APHA, ASHP. At Drake, I'm also involved in research both at the hospital I work at and through Drake. I think there's a lot of opportunities for research if you look into it, and maybe not even like a big research project, but smaller projects like helping a professor out with an article, or writing overviews for just something small. You can get into little projects if you ask. So I would recommend that. And if you do end up doing a job in the future, you have one now, asking at your workplace, because they probably have a project that a student could help with for sure. And I think for other extracurriculars at Drake that I've done, just like volunteering and things like that, but they're just more like personal things that I do. But pharmacy, those were my main ones.
Go for this question. So at the University of Iowa, actually one of the main components of our curriculum is this course called Discovery, where we actually are partnered with a faculty member, and throughout our 4 years at the college, we do a research paper. So I'm doing a survey on medical aid in dying to see how individuals in Iowa, specifically pharmacists in the community, their attitudes about that. And there's a variety of different research opportunities that you can do within that course. And at Iowa, there's just always opportunities to get involved in research. They're always sending different research topics.
I'm definitely jealous of Tyler and all of you in Iowa that have a research component. Sadly, at Neomed, that's not built into our curriculum. But in terms of residency, if that's the route that you're interested in, or just getting a job in the future, having some sort of research does put you ahead of other people that are going for the same job. So I can't agree with Mackenzie more. Just reaching out to people is going to be your best bet. They're more than willing to help you, but they're not going to come looking for you. That is something that you have to do on yourself. So some research I've done, we looked at SGLT2 inhibitors, which is a class of diabetic medications, and their risk of causing acute kidney injuries. So I worked at a hospital to help with that. We're also in the admissions committee. We just we submitted a manuscript. We were comparing our virtual interviews compared to our in-person interviews, just seeing if that makes a difference in the interview score. So I'm really excited to see if that comes out. But also in terms of extracurriculars, be a well-rounded student. You know, it makes you look good on paper, but it also just helps you in pharmacy school. I think I've met all of my best friends in pharmacy school just because we were in the same organizations, and the amount of conferences that you can go to and the fun things that you get to do with your organizations. I just highly recommend at least going out for one organization and then trying to be a leader in that organization. And that'll also help put you ahead of your peers when you go to look for jobs and things like that.
Kind of going back off of what Mariah said with the well-roundedness, just something I wanted to add was there's so many opportunities to do things, I'm sure, at every school. But I would really make sure that your CV reflects you. So trying to do a bunch of things just to do them really isn't going to benefit you in an interview. And you can get so burnt out doing that. So I would recommend really trying to focus on things that you love and that you're doing because you want to do them, not to put them on your CV, because there's going to be a lot of opportunities to do that, and staying away from that path will make it easier when you're interviewing and actually having to explain how these organizations and experiences shaped your life. So.
And I don't know if your schools, I'm sure all of you do have some sort of organization fair. So yeah, backing again off of Mackenzie, we tell our P1s to try one organization, see the one that interests them the most. And then as you feel comfortable, maybe moving into your P2 year, add another one. So yeah, I definitely agree with Mackenzie with, you know, don't overload yourself, but also don't just join things to join them. Find something that's really interesting and speaks to you, but go to your organization fairs and go ask around and see what organizations your school has in order to get you involved.
Okay, thank you for your guys' answers. So another question that we have is, what has been your favorite class or experience at pharmacy school so far?
I just kind of thought of this. I know some pharmacy schools do their like learning schedule different. So some people have like a more horizontal or vertical program, I think I've heard it said, where you learn like cardiology in every single class and you do like all of it at one time. And then other schools, you'll have it mixed in throughout and you'll learn about it in different things. So I don't know if anyone wants to speak on that, but Drake, we don't learn like one subject at a time and do it in every class. We like have it all throughout. So the specific type of class that I guess is my favorite is therapeutics, which for us is more like the clinical side of it, and learning how to like dose the drugs and really applying that in a hospital. My least favorite class was PDA, which is more learning how the drugs are working in the body and mechanism of action type things. So our like, I guess, categories of how we learn it might be kind of different than other people, which would then probably affect what classes are favorite and which isn't.
I kind of have, so we do, our classes are separated. So we have like the pharmacotherapy courses. So that's one where you're learning like, again, the disease states with the certain drugs, but we do it like each class is like, right now we're in one that's like all about cardiology. So we just did anticoags, we did acute coronary syndrome, and then we are starting heart failure. So we like have the one class designed for like a certain like broad spectrum. And then we're taking another one that's like basically all types of neurology. So I kind of enjoy those classes just because it's more relatable to what we'll actually be doing. My first year, I also really enjoyed our self-core courses, self-care. So those are the ones where we were learning about all the over-the-counter and how to counsel and recommend them. So that was my favorite class, like P1 first semester. But since after that, I'm more enjoying the pharmacotherapy courses.
Yeah, so I think similar or what Mackenzie was saying is kind of what we have at the University of Iowa. So how we do it for our therapeutic classes is we go like from body system to system. So right now we're in cardiovascular where we're also learning about anticoagulation, antihypertension, and I would say those are probably my favorite classes, just like overall the therapeutics. Um, because for some reason, I don't know if it's like superstition or whatever, but like once I learn something, the next day I'm in like put in a scenario that I'm able to use it. Um, so like for example, like we learned about hydrochlorothiazides, which are a type of diuretic, and I work through this program called Outcomes, and one of my patients just happened to need a new medication education for that medication, and just like it's so cool to like be able to learn something and then actively use it to like help our patients.
I can follow up. So one of the coolest things about Neomed is that after every single one of our courses, you're required to fill out an evaluation of the course. And so we're actually in what we're calling Curriculum 2.0, because for the last 3 years, we've been taking feedback and adapting. And now I think this is the first year that we've officially started our brand new curriculum. So we're similar to Lauren in that our therapeutics module is split into I don't even know how you word it. So we did like OTC was a module, cardio was a module, renal was a module. So not really body system, well, I guess body systems, and then everything that goes with those modules. So in terms of therapeutics, we had a critical care module that we just finished that I thought was so fun. I like that fast paced kind of feel. So if you're interested in critical care, emergency medicine, you should look into that. And then so that starts our second year of pharmacy school. Our first year of pharmacy school is your basics of pharmacy and also just your overall body systems. So we have a class that we call HAP, which stands for Human Anatomy, Physiology, and Pathophysiology. So that one's really cool. And it was described to us as what the body is, how it works, and then what happens when it stops working. So it's cool that our P1 year, we kind of learn everything that we need to know about the drugs and about the body. And then starting P2 year, we can solely focus on therapeutics and how we're going to help our patients.
That was really interesting to hear about. All right. So going on to more questions, kind of backtracking towards your undergraduate years, you've touched on what sort of extracurricular activities you are able to participate in pharmacy school. What sort of extracurricular activities did you participate in undergrad? And specifically the ones that you really think helped prepare you for pharmacy school, or ones that, you think made you a stronger applicant or just made you happy?
So as in my intro, I played softball in college. So what that really taught me was just my time management. The school I went to was very small. So I mean, the school was really good about athletes and missing school, and I had classes of like 5 students. So it wasn't a big deal to miss. But even when we did, it just really taught me how to manage my time well and set aside time for studying and for fun. So in pharmacy school, obviously, you're going to study a lot. So just having that time to go do something fun on the weekends, or taking time to just go hang out with friends or family, is really important. So it kind of taught me that. I was also able to do some job shadowing. So I was able to shadow pharmacists in like both retail and hospital pharmacy through my school for like credit or kind of like a class. So that just really got me interested into like knowing hospital pharmacy is something that I am interested in pursuing later on. So it just kind of gave me that opportunity to learn that early on before getting into school and just like, I have no clue what to do, which is okay if you do. Like, it's very common. Like, I still could change it in the next couple of years of what I actually want to do. So yeah.
During my undergrad, I was pretty involved in volunteering. The University of Iowa Hospitals and Clinics has a really good student volunteer program. So I was able to do that for 4 semesters because I did the 2-year undergrad. So my whole undergrad, I volunteered, and you could volunteer in basically any unit of the hospital, and you have the option to switch units after a semester, but I stayed in the same one all 4 semesters, and I was able to build really strong relationships with the people in that unit. And that I don't want to say my boss because it wasn't a job, but like my boss type person, I actually asked her to write a letter of recommendation for me coming into pharmacy school.
A little bit of advice, I would say, in terms of undergrad. So yeah, definitely make yourself a well-rounded student, make yourself an impressive applicant, but use your time in undergrad to then explore your future in pharmacy. So I often like to joke, the admissions committee actually knew who I was when I went for my interview because I bothered them so much during undergrad, but I think it really helped me put my name out there. And I highly recommend doing the same. So if you're in undergrad, look at the pharmacy schools that you're interested in and the programs that they have for undergraduate students. So we do something called Pharmacy 101. It's usually about one Saturday a month, and you get to talk to current students, talk to current faculty, and participate that way, and they get to know you. We also have a pharmacy boot camp. It takes place one weekend over the summer for undergrad students. So just look into the programs that you're interested in and get your name out there, because that's definitely going to help you.
So in undergrad for me, I was involved with a fraternity called Delta Lambda Phi, which I definitely contribute to a lot of my success so far in here at the University of Iowa, just because it's a fraternity that's kind of like a progressive fraternity that is open to individuals a part of the LGBT community. So I got that kind of like or support system, and also it gave me opportunities for leadership. So I was able to provide events throughout the campus that were LGBT oriented and just kind of like make those connections and kind of just progress as a leader, which definitely helped me both in my interview and also like to like differentiate myself, I guess, in the process. But yeah.
So I can just kind of do a brief summary again, but Drake is weird because we're like undergrads until the end of our P2 year. So I guess in my true like undergrad years, we also have the opportunity to join the pharmacy organizations when we're pre-pharmacy, which is kind of cool for most of them at least. And so I was in a social sorority, Kappa Kappa Gamma, pharmacy fraternity, Phi Delta Chi. I'm in one of the Christian organizations on campus, Chi Alpha. I volunteer at Gigi's Playhouse, which is a Down Syndrome Achievement Center right down the street from Drake. I was involved in a few other just like smaller organizations throughout my undergrad, just kind of exploring different things. But I would recommend, for me, the fraternity, sorority, whether it be professional, social, that kind of setup for an organization really helped me network and helped me build relationships. So if you're interested in anything like that, I've had a super positive experience. And at Drake, it's such a small school that it's a little bit different than like the big Southern schools you might see on the news. So that's just my personal experience. I would recommend the fraternities, professional or social, if you're interested.
All right, we've had some great responses. So kind of going into a bit of a more abstract question. Earlier today in our pharmacy professionals panel, who we had Dr. A from, I think, Mariah's school, and we had Dr. Dolly, who I think is involved at Drake a bit, and then we had Dr. Gandhi, who's involved at Chicago State. And a common theme that they all kind of were talking about is that pharmacy is one of the most kind of trustworthy careers that you have because of the communication you have between patients and their daily lives that they, might not see a physician for, but they come talk to you about. Given that kind of trustworthy career spot, how do you feel about your future jobs? Like, what do you think you see yourself doing as a pharmacist, and how do you feel that relates to being a trustworthy professional?
I can kind of start with this one. So I guess just like looking at the future of jobs, like the market is way more competitive now than it used to be. Even when I started and like 5 years before that, you used to be able to walk in and say, I'm a pharmacist and get a job pretty much. So just know that going into pharmacy school right now that you're getting into a pretty competitive market. But as Abigail said, it's really important, and we're very trustworthy healthcare professionals. So I'm excited to see how the pharmacist career will kind of develop over the next few years, especially since this pandemic that we're all experiencing. I think pharmacy has really been able to prove our importance in healthcare now more than ever, almost. And for me personally, career paths I'm looking into are directly after school. I would like to pursue either a residency or an industry fellowship. I'm going on my rotations this May, so kind of excited to explore different areas of pharmacy and hopefully be able to make a decision as to one of those. But one piece of advice I would give is that it's good to have a vision of what you want to do in pharmacy, but don't have tunnel vision. So if you kind of have a goal to work towards, like a residency or fellowship, keep that goal. But don't be afraid to look around and look elsewhere through your IPPE or APPE experiences.
Kind of going off of pharmacy being a trustworthy profession, and especially with the pandemic and everything, I've really been seeing that already, even currently. Like as a student, I get so many questions about the COVID vaccine specifically. So I feel like people are definitely looking to pharmacists a lot more for these type of questions than they used to, which is really cool. But in the future, I am also hoping to pursue a residency so I can get into more of the clinical side of pharmacy.
Yeah, to kind of go off of both Lauren and Mackenzie, it's so interesting um, to think how much power like a white coat has, and like trust that like once you put that on, you'll have like somebody just asking you questions about like ibuprofen or like melatonin, or just like once you put that white coat on, you're serving the community and you're being that person of like knowledge to help patients. Um, and also just to emphasize what Mackenzie said about like not going in the tunnel vision, there's so many different pathways that you can go in the pharmacy. Um, like definitely when I started pharmacy school, my general idea of like what a pharmacist could do was very limited. I was like, I'll probably either be working at like a CVS or like in a hospital pharmacy. But there's so many different fields that you can go to, like IT pharmacists, which I didn't even know was a thing, or palliative care. There's just so many different opportunities.
And kind of piggying back off of Tyler, what's really cool is while we are entering a really competitive field, if a job doesn't exist that you think that you would be qualified for and that we should have, you have the opportunity to make it. I know one of my mentors actually created her residency, and now she works as an emergency room pharmacist in a small hospital that didn't have one originally. And pharmacists are trustworthy, but you can see how much they expand patient care. Having a pharmacist on an interprofessional team was statistically shown to improve patient care. So you have the opportunity to go out and create these jobs, take advantage of it. So for me personally, right now I work with the VA, so the Veterans Affairs, and it's just the most rewarding population of people to be able to work with, to give back to a population of people that gave so much for us. Really does kind of put you into your own perspective. So I would love to stay with the VA. Like I keep mentioning, emergency medicine or critical care is my hopeful route, but obviously open to whoever will take me in. I like the idea of when you're saying trustworthiness, when people come into the emergency room or their parents are in the ICU, whatever the situation is, and they're asking us to explain everything that's going on, and we have the ability to do it, to kind of calm them down and to let them know that everything that we're doing is for the care of their loved one. That's the path that I'm most interested in.
I kind of go off what everyone else is saying as well. It's amazing to see like how much trust patients actually do have, that you're the last line, like, or the first person they want to talk to when they do have any questions about anything that they may be experiencing. But just like you're there to make sure that their health, once they leave their physician or their just any appointment they have, you're the last person they'll talk to before they go home. So like it's just important to know that like you are very important to their overall health care. Like it's pretty amazing that we're now being recognized for everything that we do as well. So it's kind of cool.
All right, so we have 5 minutes left on our panel. And I think a good way to close would to just be kind of see what kind of advice you have for undergraduates interested in pursuing pharmacy. Things you wish you knew, things that you know now, anything that you think would be helpful for current undergraduates would be lovely to close on.
I would probably say just keep challenging yourself, like in everything that you do. I think it's very easy to get in that mindset of like, oh, this is too hard for me, that I'll never be able to like accomplish this. But in the fact is that you can really just do anything as long as like you're doing what you love and you're passionate about it. Um, just keep striving to do better and like to gain new knowledge, and never like, I guess, get down on yourself if you're stuck in the mud, I guess.
I was gonna say I could follow some advice I guess I wish I had. I always joke that I don't think I should be on these panels because I don't feel like I'm an ideal pharmacy student. I don't believe in the mindset of studying every day. I know that sounds super weird, but as an undergrad student, it just felt like, you're going to be in class all day long, then you have to study all night and do it again. So I do personally give myself at least a day off where I just don't focus on pharmacy at all. And obviously that's dependent on how your studying habits are. I see a couple of my panelists shaking their heads, so maybe you guys agree. So don't get into that mindset that your whole life is devoted to your schooling and your pharmacy. You need a support system. You still need to go out and have fun and make these memories as you're young now. So that's the advice I wish I knew, is that don't put yourself in the mindset that all you have to focus on is pharmacy school.
Going off of what Mariah said, I cannot agree more. I think right now is a good time to really figure out who your support system is, because pharmacy school is hard and you're going to need that support system. And I think that's important, especially once you kind of figure out your priorities a little bit more in life. But don't be too hard on yourself. Also, I think I like to say I have like an A- type personality, like not an A, not a B, but like in between somewhere. And I used to think that there was only one path to get where I wanted. Like I have to get a residency, otherwise I'm not going to have a good life, or like along those lines for everything. And I just want you guys to know that if something doesn't go right, if you fail the first test of the class, that's happened to me, you will recover, you will be okay. Your life is not automatically over. You're not done for the rest of your schooling. Everything can be made new again. So don't put pressure on yourself to the extreme levels. You need to be happy and you need to be healthy. So really prioritize your mental health, your physical health while being in pharmacy school, because it will get stressful. And there will be times that you'll, have to make choices when it comes to sleeping or studying for the test, but don't do that every time. The last thing, which is kind of weird, and I didn't really realize this until now as a P3, but different pharmacy schools pick your rotations differently. So at Drake, we get to preference our rotations. We get like over 700 sites and we kind of rank them with the rest of our class. And in the end, you're pretty much handpicking your schedule, versus I know other schools get like a geographic region of the state from what I've heard, and all their rotations are in that region. So just like a side note, if you're interested in like traveling on rotations and you hear like one school talking about, oh, our students travel all over and stuff like that, realize that that can be different at other pharmacy schools. And if you're thinking about rotations, it's way off now. And I'm sure that's probably not something that crossed your mind because it never crossed mine either. But take that into consideration. Maybe just ask that question to your admissions person and just see what they have to say. Just because you might be thankful you asked that down the road.
I feel like all these have been really good points, and I would just add, kind of emphasize the going in with an open mind thing, because I honestly, coming in, had no idea how many areas of pharmacy there actually are. And it took getting started in my classes and hearing from faculty and everything to actually know how big pharmacy is. So I think, yeah, definitely go in with an open mind and try to explore as much as you can while you're in school, because there is so much to explore and to try.
Going off of that, I'd kind of just add, there's a lot of opportunities, even as an undergrad, to just take the opportunities you can to learn more about the profession. Since it is such a wide profession, there's so much you can do that sometimes, like, I still don't even know everything to this point yet. But just taking the opportunities to learn more about, if there's something you're interested in, learn more about it to know if it is something, oh, maybe I do want to look more into it when I'm am in school. Just start looking into things and seeing if there is something that you are interested in, and getting opportunities to get experience if there is something that interests you.
All right, those have been some awesome pieces of advice. So I think it's about time that we close our panel. Thank you guys so much for attending. This has been invaluable to Iowa State students. And we are very appreciative of you taking time of your day to come and interact with us. To the attendees, the Pre-Health Iowa State website link has been posted, so you can go to the next Zoom link for your next session. And to our panelists, thank you for coming. We really appreciate it. And hope to see you next year if you're still involved in student outreach. So.
Thanks for having us.